Dr. Walton, when is the best time for a patient to have a COVID-19 test? And what would be the follow-up protocol with their physician once they receive a positive result?
So, good question. The first thing to answer the first part of the question, that we have on our website a full list of locations in Georgia where you can get testing for COVID. We have things listed by county, urgent cares, which ones require appointments, which ones are same day results. So if you do have a positive test, the first thing we want you to do is to contact us, and we will set up a telemed appointment with you and explain to you, what you may expect and when to be concerned enough to go to the emergency room. First, there are no medicines that help treat mild COVID infection. So antibiotics don't work. Hydroxychloroquine has not been shown to be helpful. And if you accelerate and get worse and end up needing to go to the hospital, and you have basically moderate or severe infection, there are some treatments that they're using, but nothing that we can do in the outpatient that's helpful. Also, the warning signs to look out for, red flags to look out for, is to know if you're getting worse and to know if maybe you should go to the hospital, is if you're becoming short of breath. That's very concerning. And if you can have a device called a pulse oximeter or a pulse ox, it's a little plastic thing that fits on your finger and it measures your oxygen saturation. You can get them for $5 or $10 at the drugstore. And if your oxygen's going down from mid 90s down, getting close to 90% or lower, then you need to go to the emergency room. Also, chest pain is another concerning sign. After you have gotten better from your infection and you're no longer considered contagious, you do not, and actually should not, be retested for COVID. The tests are often stay positive for months after someone is no longer contagious. So you do not, and you really shouldn't get retested, because it can just keep you in a cycle of going over and over again for tests when you don't need to.
Is there any type of follow-up visit, physical exam that a patient should have with their primary care doctor, especially an internal medicine doctor, to make sure that they're not suffering from any potential negative side effects from the disease that they don't know about, especially if they don't have any underlying health conditions?
Yes, I think if you have even the mild disease that people are reporting, people say it's the worst they've ever felt, and that's mild disease. I think if you have ongoing if you were pretty sick, you have any asthma, or you just felt, kind of short of breath, or I think it's a good idea to just have a check and make sure your lungs are clear and, your heart's fine. They're just, COVID is causing so many other problems, from blood clots to heart attacks to lung fibrosis. And so, yeah, I think if you're pretty sick, it would be a good idea to follow up with us for your primary care doc.